welcome everyone. Good morning or afternoon, I guess, depending on where you're joining from. My name is Megan Douglas. I'm a postdoc fellow at Baylor Scott & White Research Institute in Dallas, Texas. I am also the newly appointed Society for Health Psychology postdoc representative. And I'm very excited today to be hosting this webinar, How to Write a Winning Career Development Award. So thank you all for joining us. As a reminder, this event is being recorded. So anyone who speaks during it, like if you're asking a question of one of our panelists, you're agreeing to being recorded and you're granting permission for the recording to be posted on our website. And was someone going to say something? Okay, well, speaking of that, during the call, I think we are going to mute everyone as they're admitted. And if you're not speaking or asking a question, we ask that you do mute yourself so that we can just minimize background noise. But at the end, we will save some time for questions. So please feel free to unmute yourself or utilize the chat function when we get to that portion. And so just a quick kind of agenda for what we're doing today. Again, this is our webinar on how to write a winning career development award. So we have some great panelists here today to talk about that. My plan for today is we're going to have one of our panelists do a very quick orientation to career development awards, just to put us all on the same page. Then I'm going to have the panelists introduce themselves and we have an initial prompt to get started. Then we've got a whole bunch of prompts to kind of get the discussion going, but I'll be sure to make sure we save some time for a Q&A at the end. That way you guys can ask your questions of our panelists. So before I have all of the panelists introduce themselves, we're going to first have Dr. Carly Goldstein provide a quick overview of career development awards, just to make sure we're on the same page.
Hi everyone. So I'm going to quickly just kind of orient us so that we are on the same page. And it's okay if you have further questions about this. We'd be happy to address them, while we're doing the main portion of the talk. So when we're talking about career development awards, we're most frequently talking about the K series from NIH. Other awards that you may have heard of are F31s, which are predoctoral, F32s, which are postdoctoral, and are funded to the investigator. And then, of course, there's ours, and many people do T32s for fellowships as well. So frequently for Ks, it's a grant that you're going to write while you're on postdoc, and it's to support your transition to faculty. I tend to kind of think about a couple of different groups of people who might want to apply for Ks, but something we're not going to talk about as much today is the Diversity Supplement Program. This is a really fantastic experience for folks who have a mentor or want to find a mentor that has an R01 and they come from some sort of racial or ethnic background. That's a group that's typically underrepresented in the health services research. So this is definitely a great option, and I would say that the task for the diversity supplement for all of you is, I'm guessing most people on this talk are grad students and postdocs, and so I just encourage, if you are in a lab that has undergraduates, to mention this to folks, because there are high school and even undergraduate options, and just to kind of make other people in your lab aware that this exists. But for today, we're going to talk mostly about the K series. I'm going to group the K01, the K08, and the K23 together because they're kind of the most common. If most of you on the call are clinical psychologists, most of you would be applying for K23s because that's the mechanism that's geared towards folks who are trained in some sort of patient-facing or patient-oriented work. On the other hand, say like an experimental psychologist or a non-board certified medical doctor would probably apply for a K01. But the K awards are meant to include both a training component as well as a research component. And it's basically supposed to be a jump start to your career. So you should consider applying for a K if you're someone who already has a proven track record of, aptitude and work in research, and you're hoping for a probably grant-funded career in whole or in part. The important kind of thing to distinguish is that they typically are about 4 to 5 years. The budgets range from 25 to 50 grand, depending on the institute. And I'm sure this is something we'll address, but whether you're asking for 4 or 5 years or you're asking for 25 or a higher budget, you need to have a significant, cohesive justification for whatever you plan to ask for. And that's something that we'll address later. On the other hand, there's another grant that I think it's called the K99 ROO. I only know it as the kangaroo. That's what most people call it. So this is kind of a different version of an R. It's the Pathway to Independence Award. And it's made for folks who really just need kind of a few more, at least one, sometimes two, mentored research years, but then are kind of ready to apply for the R. It's important to note that getting this, the K99 does not guarantee getting the next R phase. You have to demonstrate that you're making progress. And the kangaroo is a really great mechanism if you're someone who is planning to go on the job market and, want a few more years of mentorship, but then are planning to go into a tenure track program, say in a psychology department. And then lastly, there are also VA mechanisms. That's something we're not going to talk about a ton, but most folks on this call who would be applying for a K, if you were employed by the VA, you would probably apply for a CDA too. And that's very similar, 3 to 5 years, includes training and research. On the other hand, there's a very specific CDA level 1 that I truthfully don't know anyone who's done that. And then the CDEA is similar to the mid-career K series. That's from NIH, which I think is a K24. But in the interest of time, I'm going to turn it back over to the remaining panelists, and we'll kind of get started with the main portion. Is it okay if I stop sharing my screen, or should I keep this up? Okay.
You can go ahead and stop sharing. All right, so I am going to go ahead and have our panelists introduce themselves because I also have an initial prompt I'd like you guys to all start. So I'm going to go ahead and send it in the chat just for your reference. But go ahead and introduce yourself, your name, your position, but also if you are currently a CDA recipient, then the prompt we'd like you to talk about is your current job, how you got there, and what your award is about. If you're a mentor of other people who have CDAs, what types of career development awards have you actually mentored? Also answer that. And then what is the one thing you wish you had known or wish every CDA mentee has known as they're actually crafting their proposal? So those sage words of wisdom that you might pass on. So let's go ahead and start, since we already had Dr. Goldstein speaking, would you mind starting?
Sure. Okay. Can you hear me? Okay, sorry.
Yes.
It showed me I was being spotlighted, and I've just never seen that in Zoom before. I got nervous. So my name is Carly Bolstein. I'm an assistant professor of research at Brown University's medical school. And I'm a research scientist with the Miriam Hospital at the Weight Control and Diabetes Research Center. So I'm currently in about year 3.5 of my K23 that's funded by NHLBI. I went to Kent State for my clinical psych degree. I matched at Brown for residency, stayed on a T32 for fellowship, and kind of near halfway through my first year, I think, I submitted, or I started writing my K23, submitted it near the end of the first year of the T32. My K was not discussed at first, which I found out at a conference. So I went back to my hotel room and cried for like an hour. And then I went back to the conference. And I prepared a resubmission, and my grant was like well within the funding range the second time. So I think one of my like key points is it's okay if your first grant is not scored or not discussed or whatnot. it's still very much worth resubmission. And my award is about using the multi-phase optimization strategy to optimize a technology-based weight loss program for folks who are currently participating in phase 2 outpatient cardiac rehab.
Great, thank you so much for joining us. So again, I put those prompts in the chat. Let's have one of our other panelists introduce themselves. How about Dr. Powers, would you like to go next?
Sure. Welcome, everyone. My name is Scott Powers. I'm a professor of pediatrics and an endowed chair at Cincinnati Children's Hospital and the University of Cincinnati College of Medicine. I'm a pediatric psychologist by training, and I do a lot of work in clinical trials. My background, I did not have an early career award in the early part of my career, but I did have some pilot funding from different foundations that set the stage for NIH grants. I did receive a K-24 award, which is a mid-career investigator award during the course of my career, and I had that for 10 years. I've been the program director of a T32 postdoctoral training grant in child behavior and nutrition for 18 years now. And I've mentored KO1s, KO8s, K23s, as well as F32s.
Thank you so much. It's so nice to have you. And it sounds like we've got a really good variety in our panelists' background, which is great. And so last but not least, we have Dr. Derry.
Hi, everybody. Looking forward to speaking with you. I'm Heather Derry. I'm currently a postdoc at Weill Cornell Medicine in New York City. I'm in the Division of Geriatrics and Palliative Medicine. My background, I'm a clinical psychologist and completed my PhD in psychology at Ohio State. Went on for internship at the Cleveland VA. And I came to Weill Cornell after that as a T32 fellow, which was about 3 years ago now. Really to learn how to apply my background in stress and biobehavioral research to more of a clinical application and to aging. And the program that the T32 program had a strong emphasis on preparing for career development awards. So during that time, put together a K99R00 application that was recently awarded just literally within the last couple weeks. And so I'll be kind of coming from a recent applicant perspective on that and really just trying to channel some of the good advice that I've heard from peers and mentors along the way as well. The study that I have been working on for the K99R00 is through the National Cancer Institute, and the goal is to study how stress and anxiety impact the understanding of information discussed in medical appointments, particularly in this case for advanced cancer patients awaiting scan results, and then to adapt a behavioral intervention to help with stress management. As far as the last question about one thing you wish that you had known, gosh, there's, I think, a lot that I'm hoping that we'll cover today, but one thing that I would say is I wish in getting started that I had a little bit more of an accurate expectation about the time and mental fatigue involved in all of the other parts of the application, aside from just the science and the research plan, which I think we tend to like start out thinking about a lot, but you know, in terms of other pieces on administrative pieces involving mentors and letters and a lot of other aspects that go into the application can be really time consuming and can also just be a way to help prioritize your time. So that's one thing that I would definitely recommend kind of thinking about as you get started.
Thank you. Thank you to everyone for introducing yourself. So I'm going to go ahead and get started with some of the discussion questions. And so I'll go ahead and type the prompts as well as say them. That way, if it cuts out, you guys know what we're talking about. And I'll just welcome the panelists to just unmute yourself and jump in. Some of you might want to respond or pass. So I'll go ahead and leave that all up to you guys. So the first one, I think based on what we just heard, is a good place to start. Someone asked, how do you decide which institute to take your K to?
I think there are a handful of approaches that you can use. One thing that was kind of the governing thing I kept coming back to was thinking, about my really long-term career and where do I see myself wanting to be funded the most. And I feel very fortunate that I'm able to do very multidisciplinary work. And so I could see a number of different institutes being, possible sources of funding in the future. But I really kind of identify as like a specialist in cardiovascular behavioral medicine. And most of the angles I'm coming at my work from are focused on prevention or secondary prevention of cardiovascular disease. And so because that was both where I wanted to go, as well as a lot of like what I had done, but still felt like there's so much more that I needed to learn in order to be competitive for an R01 from NHLBI, that seemed like a really great fit. And the other key thing was I drafted up a specific aims with my mentor, and we tried to get in contact with a PO at NHLBI. And it was really helpful to talk to the PO early on because I was able to kind of tell them my perceptions of what I thought NHLBI's priorities were at the time for K Awards and kind of where they saw their research portfolio going in the coming years, and was able to then like appropriately triangulate, the rest of my application to be a natural fit for that. But it is something that can be kind of hard to do, especially if your work is more multidisciplinary.
I think that's a really good point, that your topic area in some ways is going to define the breadth of institutes that you might be most responsive to. But it's really going to be that communication with the program officer and looking at the website and really getting a sense of how are they reviewed? Are they reviewed internally, which more often than not they are? What areas of research that they're emphasizing? Doesn't mean that if they don't emphasize it, it might not be applicable, but it does give you sort of a roadmap to look at where you might be most responsive. And then pragmatically, different institutes have different amount of research funding for K Awards. Some are higher than others. So there is the pragmatics of the scope of the work you're planning and how you're going to fund getting what is expected to be pretty intensive work done on a relatively, if not excessively limited budget. So that's another component. But I think Carly's point about having your aims kind of prepared, thinking about your area, and then really having discussions with program officers is really a key early in your planning. And then for what Heather said, you need to plan 6-7 months worth of work here to get a good K or an RO, a kangaroo grant kind of prepared. It's not a 3-month or 2-month plan. It's probably 6 to 9 months of work.
These are great recommendations. Just one other thought to add if you're a little earlier on in thinking about institutes. I think NIH Reporter can be a really helpful tool to look at you could look at different institutes and what types of Ks tend to be funded by them, or you could look kind of by topic and see, in your area, what institute tends to be funding those kinds of projects. So I would definitely check into that and try and take advantage of that public info.
You have to be curious and really persistent at investigating information, since it's your career, that's for sure.
If you don't like investigating this part, you might not like doing a K.
That's true.
That's really some great input. And I'll go ahead and piggyback off some of the things you guys said. One of the other questions was actually someone asked, when and how should you speak to a PO during this process? You guys mentioned that, but do you have anything else to add?
Good kindergarten skills are very important. Kindness, diplomacy, understanding these folks have very challenging positions. An email reach out is oftentimes a way to get started because, I think the phone call is very important, but just calling someone up out of the blue when they haven't had a chance to be prepared or know what you're calling about, really, I don't think is fair to our colleagues at NIH. So some type of an email with a little inquiry. When could we get together to have a chat, attach those aims page if you have it. If not, they might ask you for something to look over before you have a phone call. So kind of be prepared for that as well. But it is important to start that relatively early Your relationship, if you have been on a T32 or you've had an F32 or F31, if it's a similar institute, you already have some contacts and people that are already invested in your career, and they do want to continue to invest in your career at an NIH program level. The better you do over time, the more awards you have, the better they look to their boss. Right? I mean, this is part of them wanting to be in a position to further science and further young people and early career people. So they take this very seriously, even when they're stressed and busy. But I've always found an email, giving them a little time to plan, and then setting up phone conversations to be the best approach.
I'll just share a quick example. This is definitely something I'm still learning. But in just kind of thinking about not knowing always what else is on program officers' plate, depending on the different times of year and things like that. So I would just say, don't get discouraged if you don't hear back immediately. I've been, in my case, lucky that my program officer has been very responsive, and I know of other cases where I have colleagues that have a hard time catching that person. So it might not necessarily mean anything about you as an applicant or your idea if you don't get responsiveness. So I just wanted to kind of put that out there. But one other, kind of quick thing that I would recommend talking with them about early on is your just confirming eligibility for the grant. These kinds of grants have like more complicated eligibility, I think, than some others, and you would want to know up front if there's some issue about your years from graduation or your title or something like that, just to guide to make sure that you're looking at the right type of mechanism.
I would definitely agree with that. There is variation amongst program officers. There's different levels of experience. There's many of them shift between institutes as part of career development and their own career progressions. So hopefully you're on the luckier side of responsive program officer, but don't get overly discouraged if they aren't super responsive. Remember, they're not the ones reviewing your grant, and they're not the ones deciding ultimately about the fit with the institute. That doesn't mean they're not very important colleagues, but it's not someone who's going to make a sole decision. The other thing that I think was very well mentioned by Heather is, if it's a week before or a week after their scheduled council meeting for that institute, you're probably not going to hear from the program officer. If it's towards the end of the fiscal year, which is happening right now, September to September 30th, you might not hear from your program officer while they're trying to get other things together. So there are some times when you're can look at the calendar and look at the NIH calendar and kind of get a sense of like, they're probably super busy right now. Doesn't mean you can't email them, but you might have to email a few times to get some response.
I laughed before when Scott mentioned basic kindergarten skills. I remember in kindergarten hearing the story of Goldilocks and the Three Bears. And with NIH grant writing, I think so much about Goldilocks and how you're trying to find like the right medium of so many different things. So exactly as was mentioned, I think it's important to contact them when you have a formed idea, but not when it's so formed that you start to feel like wed to it and inflexible. You want to talk to them at a time where you can give them the best sense of what you're trying to do to get the best feedback from them. And then that you're able to kind of pivot where you need to, if maybe you're picking up on something that does not align as much with like their priorities for funding Ks. I'll also add that I had a lot of trouble reaching my program, like any program officer at first, because they were doing some restructuring of who was like the right like point of contact for the type of K I was doing. And so it did take quite a few, I think weeks even, of like phone calls and emails and whatnot. And it was really helpful to have my mentor CC'd, because I felt very powerless when someone's like not responding to my email, but for my mentor to then reply all and be like, hey, it's been 3 weeks, we don't want to bother you if you're not the right person, but is there somewhere else we should direct this? He was really instrumental in kind of helping me. And by that token, I would also say if like your mentor is not being supportive in trying to help you connect with a PO or work through any other barriers you're having as you're writing this grant, then if they're going to be your primary mentor on the K, that's a bad sign, because you're going to be really relying on them for 5 years. And so it stinks if that happens, but it's much better to find out soon. And you really want to make sure that your mentor is someone who's really advocating for you. Kaylani just asked a great question about the PO's role. I'm going to sort of defer to not do that one just because I've only talked to a few POs ever.
So program officers at NIH are scientists just like all of us who have chosen at some point in their career to go in and work at that level to be part of the portfolio of research of an institute. And those that choose to be involved in these types of grants very often have a passion for career development and even some mentoring experience. So they're very well prepared in most cases, like I said, and people have said here, sometimes people are moving around in positions or budget cuts happen at the federal level and they're trying to figure out who's going to pick up this portfolio of grants, et cetera. So don't take things personally. Try and be diplomatic and persistent and find the right person. But generally speaking, they're going to have a scientific background. That doesn't mean it would be in behavioral science necessarily. It could be in even basic science and still be a K awardee type person. But usually for K01s, 08s, and 23s, they're going to be more in the clinical scientist type of a background. For kangaroos, many times they're going to be basic scientists. In fact, those are more common. So you're going to see a lot of program officers that might have even animal model experience. But they're people just like us. There's some that are early career like you guys. There's some that have clear hair like me or little hair that have been around a long time. So it is a very important relationship because they are investing in you, but it does take a little persistence from time to time.
Thank you for
They
that.
They do have bios on the website, so you can look up and get a little background on the program officer that's listed for that institute and find out a little bit about them, see their picture, those types of things.
Some really great tips on the relationship kind of with the program officer. I want to segue back to something Dr. Goldstein brought up, talking about the mentor. So the next question's here. How do you select a primary mentor? And then also coupled with that question, who else is important to include on your mentorship team?
Generally speaking, it needs to be someone with current NIH funding for K awards. I have seen K awards come in from departments of psychology where the primary mentor was very well established, very successful scientist, but did not have NIH funding. And at least at NIDDK and NINDS and NCCIH and NINR, different study sections I've been on, the modal reviewer is not going to see that as someone viable, even if they are tremendous and have a great reputation in our field. If they've had university funding or other kinds of funding, but really not NIH funding, that's going to be a negative on most K awards today for K23s. So there's lots of other things about your mentor that are very important, but pragmatically, record of and current NIH funding at an R01 level is pretty sacrosanct.
Out just a couple other ideas that come to mind too. I feel like I've heard various things on some of this, but in terms of thinking through, you want someone with expertise in the area that you're moving towards, and they might not have expertise in all parts of the training that you're trying to get, but there should be, back to the point about justification, there should be a clear link between why you're working with that mentor and what training you're trying to get and what study you're proposing. So that's something to think through. And back to a point that Carly made earlier, definitely as the applicant, ideal if you are able to work with someone that you have a good working relationship with, that you already know will be responsive and will go to bat for you if needed. those kinds of qualities that we all look for in mentors in general, I think apply here. And then just one final piece is that I also, at least for the K99, got the sense that reviewers also tended to want to know how you are distinguished and independent and different from that person. And so thinking that through as well, like how your work is going to take you in a direction that you may need that expertise to help you reach, but how you're going to be able to contribute something unique.
Those are really good points. A couple of other things that I know that I was thinking through that I can add. I was told that generally your mentor, especially your primary mentor, should be associate professor or above. I think it's a little more rare to have a primary mentor who's an assistant professor. And my primary mentor was like just going up for associate professor, had a fantastic NIH track record, but had never been the primary mentor on a K23 before. He had been a co-mentor a couple of times. And so the head of my research center, who's very senior, who's been primary mentor to probably over 20 K awards, she was a co-mentor of mine. And so we were also actually very strategic about the letters that they each submitted, where we included in both of their letters a note that my mentor, Graham, would actually even be able to receive mentorship from Rena on mentoring me. And so you want to be very strategic about all the parts of your application. You know, when I think of the letters, I think of they're like talking about their commitment to me, but you actually are trying to use multiple parts of the application for many different things beyond their original intended use. So it's really good to be strategic about that. Another experience I had was with inviting co-mentors. You know, Linda Collins is the creator of the multi-phase optimization strategy. And I thought it was a total shot in the dark for me to ask her to be a co-mentor. Like, why would she care about some rando, you know, like a couple 100 miles away? And I emailed her. She was immediately willing to meet with me at an annual meeting. And I think most people are not this lucky. She just like offered in the conversation to be a mentor if I needed it. And so that was so wonderful and fortuitous. But I was just so surprised throughout the K process of how generous established investigators were with their time. I was kind of having trouble understanding like why, you know, this is not a paid position. Mentors don't receive funding. And so it's kind of like, why would they want to do this for me? But I think it's actually really important as you're thinking about your mentorship team to think about it as a bi-directional relationship. And so by you gaining this training, you're then hopefully establishing yourself as a collaborator with them, and then you can bring some unique perspective or some unique skills to their future applications and their work. And so as you're kind of putting together your mentorship team, I would think about your training plan and, you know, all the things that we normally think of, but do think of it as a bi-directional relationship of like, what can I bring to them, and like, what could we do in our future work together this K would uniquely prepare me for that would really advance science in some way.
All right, thank you. So these next few questions, I feel like we've talked a lot about the pragmatics and logistics and planning, but also just thinking what is involved with it, right? What does it actually look like? So what does a career development plan look like? And are there any pieces that you should really consider including? So kind of get into the meat of the.
I think Carly sort of alluded to the complexities of a K award grant. It's really 4 grants in one. And the ones that get funded, they all sort of blend together like an orchestra, and they aren't separate. So we've talked a little bit about, you have to have a mentor that has the background, the funding, the experience that's needed to get a high mark on mentor. You have to have a science plan that's quite feasible, but still is compelling to move the field forward, and programmatic in nature, because you need to know what's going to come next. and you need to have data relatively early in the 5 years so you can start publishing from it, which for clinical investigators that like to maybe look at interventions can be a little challenging and one you have to look at. Then the career development plan and the training plan really needs to fit where you are in your career and where you need to go. Now, many of our physician colleagues that don't have as much scientific training, you see, I'm going to get a master's degree in clinical and translational research, and it's relatively straightforward. For PhD level psychologists, it tends to be not quite as straightforward. You're not going to go get another degree usually, but there are usually some stats, methodology, informatics type of courses that you could take that would fit your area. It might be epidemiology as well. And then you may have some more individualized tutorials. You know, maybe you need to really get into the pathophysiology of a certain disease, or you have a basic science or a physician mentor that's going to help teach you and get more in depth about what you're working on. So you can have a more independent study, if you will, as long as it's clear and guided. Those are oftentimes what I see in clinical psychologist K awards, is that they're getting more in-depth experience in the pathophysiology and the disease that they're looking at. But it may also be other types of science. But that career development plan needs to be just as well constructed and thoughtful as the research plan. And then obviously the fourth part of the grant is you and how you present yourself, and do you have a publication record, and all those types of things that they look at to value whether or not you're a good investment. And at the end of the day, for a K award, it really is an investment in you who has an idea, not just an investment in the idea the way it might be for an R01 grant. So you are the most important component of your application. I don't know if you guys who have more recent experience would have other thoughts about how you framed your career development plan or training plan versus research plan and how they all came together, but they do need to sing in a nice orchestrated way, which Carly might have learned on that second submission, how to really hit it out of the ballpark, it sounds like.
Thank you. I did not hit it even in the ballpark the first time, I think.
That's
but,
okay.
So I think that a couple of things that I considered, one thing I was really frustrated by that was one of the things I got dinged on, was that I didn't include very much coursework in my initial submission, which seemed obvious to me because I already have a PhD. Not that I know everything, of course, but I was like, I don't need to sit in a classroom. And for me, that's just not the way that I learn the most. And NHLBI at least had a real issue with me not signing up for more courses. I was also frustrated by that because the courses, at least at Brown, are really expensive. And if I wasn't going to be approved for that $50K budget, I easily would be spending a third of my budget on like 1 or 2 courses a year. And so that was really tough. So I kind of did a mix of coursework. One thing I said was like, I'm applying for scholarships to go to this conference, this and this, and any leftover funding I have will be applied to additional coursework, like at our School of Public Health, and I listed even specific courses. So, you know, sometimes it's on the response that you don't even necessarily make changes to your training plan, but you say like, if things work out, I'm gonna, you know, do this and this. So another thing is I wanted to apply to a couple of fairly competitive, you know, training opportunities like NIH's Summer Institute on Randomized Behavioral Clinical Trials, as well as their mHealth Institute. However, it's very important to not rely on acceptance to a competitive, you know, program as your training plan. So the way that I addressed that was I had a specific course picked out that if I was not admitted in the first 2 years of my K, I would then do that course locally and use the funds that way. So that was one thing that I got around. And I should also mention that Claire had asked on the last question if I found it feasible or acceptable to have co-mentors outside of my institution. I was actually really frustrated by how not into that they kind of seemed at first, which I think the joke is sort of on them, because now everyone, even if you're local, nobody's seeing anyone in person and we're all getting work done just fine. So that's my own, you know, crusade to go on later. But you know, so I was able to actually highlight for my career development when and where I would see these mentors. So for Linda, who was at Penn State, I actually put in like the number of mileage, like the amount of mileage and what I would get reimbursed at in my budget to drive to Penn State once a year. And, you know, to get that sort of support, and utilizing meeting my mentors at annual meetings. And the other thing that I used was talking about just attending pre-conference workshops that were related to my training and development plan at the stuff at like the conferences that they were already going to be paying for anyway. So I think it's, you know, really key to make a robust training plan, to kind of have backup plans for if some parts of it don't work out, and to be very thoughtful about how to like stretch the dollar the best.
I think your point about there is bias in study sections about primary mentors being close to where you are, same institution is definitely preferred. Whereas co-mentors or topic area people like Dr. Collins, those, especially when weave well into your project and a real clear letter from that person that I'm dedicated, I'm going to do this, specific details that kind of matches up with what you wrote in your section, is part of that orchestra part that it all sings together. But primary mentors, generally speaking, even in, I think, these days of COVID and Zoom, they're still going to want that person to be pretty close to where you're at. Partially that's protecting you within your institution. Part of it's the drop-by discussions, but I do appreciate that that bias will probably soften over time with just our real-world experiences. And when you guys are the reviewers of Ks, you probably won't bring that same history.
I love all of these concrete recommendations. I think I would echo that. And just to add, I think in terms of the orchestra, the integration of how your training goals might also be integrated with the study and research plan is something that I had also heard can be helpful. So for example, in part of the study that I had included, I have not had experience in mixed methods research or qualitative work, and that's something that I'm hoping to get further training in on the grant. And so kind of experientially by doing that piece, that was another part that in my particular case, the reviewers felt that upfront I didn't have enough of that type of training experience. I was like too heavy on things like coursework and other things. So that's another way to maybe think about integrating into your training plan. And then just to be very like literal about it, I would recommend making it very crystal clear about, you know, I have this many training goals, like 1, 2, 3. I don't know what the magic number is, but maybe that's something we can all kind of talk about as well. But making it very clear what those goals are and how they map on to your project and your mentors, I have understood to be very important too. And I think, you know, in terms of a part that you might, you know, recommend including, I would really recommend including some like very straightforward way of seeing that information. So whether that's a figure or like a table that summarizes all of those goals, and you know, whatever part feels most relevant in your application, if it's how it maps onto a mentor or a part of your study or trainings. I think there's a lot of different ways to do that, but you know, I think it's easy to get buried in the weeds of like walls and walls of text about your training goals and what you're going to do. So if there's some, you know, great way that you can think of to summarize that in a table or figure, I think that'll do you a lot of favors.
Great, thank you all to our panelists. So at this point in our webinar, I want to save some time for Q&As from all of our participants. For those of you who did join us late, just a reminder, we are recording. So if you ask a question of our panelists or type something in the chat box, you are giving permission to be recorded and have that posted on our website. But with that being said, I did see that there was a question posed in our chat already. So I don't know if any of our panelists can speak to this, but someone asked, what are the similarities and differences for VA CDAs?
I can only speak to it a tiny bit. I also have an appointment at the Providence VA, and so I was considering submitting a CDA there. I do know that I think some of the VA CDs can be as little as 3 years. So it's more 3 to 5, whereas from NIH, I typically see 4 to 5. In my personal experience and from what I've heard that the VA IRB can just take a really, really, really long time. And so that may be different or similar to your non-VA institution, but that's just definitely something to consider when you're structuring like a training plan in terms of if you especially want to do some other additional little study during your K, allowing enough time for that or during your CDA. However, one major asset to the VA is CPRS, the medical record system. And so I do know some folks who did a VA CDA and they really utilized being able to like pull data from that. And so that was actually really helpful if their research project was structured in a way that they weren't really going to have like analyzable data until the end of the award. They were able to get data that they already could get access to earlier on, and so that sort of helped shape like what they were going to be doing training wise and writing papers wise. Otherwise, I'm not super knowledgeable about the VA awards, unfortunately.
Thank you for that insight. I also did an internship at the VA, so I can speak to the delay of the IRB within the VA system. So really good point. I'm going to open it up to see if any participants have questions. I also have some that were submitted. If you guys want to unmute yourself, again, we muted everyone at the start, so just make sure you hit that microphone button, unmute yourself, or if you prefer to put it in the chat box. Any questions for our panelists?
So Dr. Powers, I would love to hear what it is. I heard a little bit of K awardee speculation about why anyone would mentor K awards, but you have chosen to mentor multiple K awards, both within psychology and within neurology. So I would love to hear like, what is it that when a potential applicant comes to you and says, hey, I'm thinking about doing this K award, either as a primary mentor or as a co-mentor, what are the things that make you think that it would be a good investment of your time and energy?
I'd say it's a great question. I think the first thing I ask myself if someone comes to speak with me is, am I going to be able to do a good job and really be helpful to their career? So that means, do I have the expertise and the background that I think would be compelling to help you get funded? So many people in our profession are motivated, bright, sweet, good, solid human beings. So you start with those kindergarten basics. You need to make sure that your mentor has those attributes and that you bring those attributes to a partnership. But I think a lot of it is assessing, are you the right person both to help that person's career, but also help that person be successful in what is a very challenging grant to get funded. And then once you have the grant, it's quite a challenging grant to execute, both due to low resources, competing demands when you have a license, if you're in that particular scientist practitioner role. But a lot of times it's really thinking through, am I going to be able to do the best job? Or thinking in an institution like mine where there are a number of NIH-funded psychologists, is there a peer of mine that might be better? If I don't have that luxury of being in a large institution, it still comes down to fit and making sure that you can invest wisely so that person can be successful. I think the longer your career goes along, the reinforcer, at least for me, has always been, I get a real kick out of watching other people be successful, far more than whether or not I get another grant or a paper gets accepted. Not that that's not exciting, but and then I think it's a commonality of values, right? I believe that research is all about helping the patients that we take care of. So if we are really moving forward in a way that fits my motivational system, then I know that it's the right fit. Those are kinds of the things I think about. And then it's the process of if you take 6 months to develop one of these awards, you kind of learn during that 6 months if you've got the right relationship to be successful once the person is successful with the grant. It's kind of the proving ground, as a couple of the people said today. If I'm not doing a very good job as a mentor now, I'm probably not going to be very good later. So it is a bi-directional relationship.
Thank you, Dr. Powers.
Thank you. So I see there's another question here. Someone asked, is there any advantage or disadvantage for applying after postdoc, but still in a similar career level, like a research scientist? Or is it even possible to still apply for a K award?
So, you know, depending on your goals, it might still be a great time, or it might even be a better time to apply for a K. Typically for the NIH K Awards, and you should check your specific institute that you want to apply to, it's usually a maximum of 6 postdoctoral, not like doing a postdoc, but just literally since you've graduated. It's usually a maximum of 6 years, but there are exceptions for childbirth, natural disaster, times where you were working less than 50% effort. You know, there's a variety of circumstances that could extend that timeline, but it could really be an advantage to actually apply later. So first of all, your department, especially if you're in like a psychology department, they would probably be thrilled with you if, you know, you were able to say, oh, I can actually get 75 to 100% of what you would need to pay me covered for the next 4 to 5 years. There's not a lot of people who are decent at math who wouldn't be excited about that. And you would still probably need to allow time for, you know, departmental requirements, whether that's teaching or supervision. But there are kind of ways to get around that. One thing we haven't talked about is for the K01, K08, K23s, you can move those Ks, but there are stipulations, whereas the kangaroo is more set up to naturally facilitate you moving in the middle of it. And so some people actually like to wait and apply for their K once they are already at their new institution, because it you know, reduces the chances of interruption for data collection. That your mentorship team is probably going to stay pretty stable. So I think that if you have a good, you know, rationale for why you would be a good beneficiary of a K award, you should definitely consider it. And, you know, if you're kind of more on the edge of any of these things, like you graduated close to 6 years ago, et cetera, it would definitely be a good idea to talk to a PO very early in that case.
And this is where when Heather brought up that there's lots of idiosyncrasies, right? Typically for K awards, you need to have some appointment as a faculty position by the time the award is received. And generally the reviewers like to see that that letter from the institution is clear that they're backing you and want you to be successful as a scientist regardless of funding. Now that can be written in different ways in letters, but at least when I review those grants, I can really tell when it's more like, well, if they get this, that's great. And if they don't, well, you know, it's survival of the fittest. That usually gives me an environment score above 6. I'm probably a little harder on that than some of my peers, but I really do believe they need to be dedicated to your scientific career, even though we have to deal with the pragmatics of financing. So that's something just to check into. Doesn't mean you can't write it before you have that appointment. One of the things I tell our mentees as T32s is when you go in to look for academic positions, you're likely going to be talking about a startup plan. You might be looking at internal grants. You know, your science plan for a K award may have those fundamental stair steps that could be used for internal grants, used for startup money, et cetera. But you want to start thinking about that strategy, whether or not you end up going to a place that has an R01 investigator that's a great mentor and has the right environment and has it may not have all those things, and it may still be the best job for you. So you may be building your own K award by your internal funding without having as much support for your salary. But scientifically, that kind of strategy is the same, whether or not you're doing a K award or you're building it more by other resources. So that's a pragmatic thing that a lot of the fellows and I talk about, because that's your scientific planning, whether or not you write a K award down the road or not.
Be okay if I just jumped in on this person. So I'm Betsy Sang. I'm in my year 5 of a K award, which I did submit during my second year as a faculty member in a traditional psychology department, but that's attached to a very large medical school, which is soft money. So I think one of the other things to really think about if you're planning on submitting a K award is that, yes, the NIH wants you to submit K awards, but your institution might not. If you're in a soft money position, that 75% effort is gold. But if you're in a hard money position, you have to understand what the administrators like give and takes are for that 75%. If they need you to see patients, and if they have to give you that time, they have no one to see all these patients. It's a huge backlog. It actually makes them look worse. They don't really want you to get a K award. Similarly, if you're in an academic institution where you have large teaching responsibilities and large undergraduate classes and like faculty rather than graduate students or adjuncts teaching is important to them, they may not want you to have to buy out of that many classes. So if you're in a soft money position, Ks are great. If you're in a hard money position, you really need to understand what the goals of the administration is around your hard money responsibilities. And, it often takes negotiation to make that successful.
With the few minutes we have left, that actually is very relevant to one of the questions someone submitted with their registration. So they asked whether health psychology or clinical psychology awardees have been able to creatively build in clinical work, such as 10 to 20% time per week to supplement the K award. Someone else actually asked too, how can you work on making sure both of those components are in there, which I think is quite relevant.
Very typical on K awards for you to have some time to do clinical work if you have a license. The mode for KO1s and KO8s, these are more often physicians than psychologists. They're going to continue to do some care. If that care is in alignment with the population you're studying, it really is advantageous, I think, for you as an investigator clinician, as well as for the continuity of your grant. But it's certainly acceptable, whether or not it's teaching for 25%, or whether or not it's patient care for 25%, whether or not it's clinical supervision of graduate students for 25%, just to be clear about how that is in your long-term goals, because many of you may continue to see patients even if you have a very successful research career. You're probably not going to see more than 30% and still have a super successful research career because of time, but you're going to do some of that. So I find study sections quite amenable to that with people with licenses.
Speaking of time, I'm going to jump in here real quickly, and then if we have some remaining time, we can keep going on that. I just want to thank everyone for joining us for the webinar today, especially our panelist speakers. We really appreciate your words of wisdom and insight. I think we've had some great questions. And importantly, as a reminder, don't forget all of our participants to renew your Society for Health Psychology membership for 2021 so that you can keep participating in great things like this. So there's going to be additional webinars, teleconferences, listservs, awards, and a whole bunch of other benefits that you can have with the Society for Health Psychology membership. And don't forget, it's not necessary to be an APA member in order to join the Society for Health Psychology. So thank you, everyone, for joining. Thanks to our panelists. What?
May I say one last thing?
Yeah, sure.
So let's assume you're all successful and you get your K award. You needed to submit that for 5 years, not 4. 5 years goes very fast. The day after you celebrate getting your K award, go back to that sense of urgency that you need to get another grant. It's hard practical advice, but we're all human, and I've seen people say yes to too many things, even with guidance, and you get to year 4 and you wish you could go back and start again. So when you are successful, hit it just as hard.
Thank you. All right, Claire, Barbara, anything else to add? All right, thank you so much to all of our panelists and participants.
Thank you.
Really appreciate your time.
Everybody.
Bye, everyone.
Thanks, everyone.
Be safe.